Assalamualaikum warahmatullahi wabarakatuh. As a team leader, I, Novita Kurnia Sari, will present the enhancing the capabilities of medical surgical nurses at PKU Muhammadiyah Gamping Hospital. So far, these nurses participating in continuing professional development have only been used to fulfill the obligation to extend the registration certificate accordance with their authority and competence, also to enhance their career. Nurse competence must be an important point because it can result in patient satisfaction and patient safety. According to prior research, the INA-CPD is an e-learning platform that may be utilized as one of several CPD methods that use online learning, allowing nurses to continue working without leaving the hospital. The identified issues in PKU Muhammadiyah Gamping Hospital can be resolved by implementing new training methods designed to introduce online training system by enhancing self-learning and adult learning approach. Four steps that are carried out consist of: step 1 is pre-planning. The service team and partners together strengthen their commitment and synchronize the goals of this community service activity. The curriculum that has been prepared is realigned with the purpose of the activity. Step 2 is planning. At this step, the team prepare by identifying training topics, presenters, time and place of implementation. Step 3 is execution. The activities planned at this step are trial online training in accordance with the curriculum that has been prepared. And the last step 4 is evaluation. Activities at this stage are evaluating community service program. One of the evaluation uses average competency score. This community service activity functions as a pilot program for online training. The technical implementation aims to grant trainers and nurses access to INA-CPD. Nurses independently acquire knowledge by studying the materials and accomplishing all assigned tasks. Socialization of the use of INA-CPD online was provided to trainers and nurses. In this activity, all participants were allowed to post inquiries that required further clarification. Subsequently, participants are granted access to the online training trial by being provided with a username and password. Nurses receive feedback, and the score of the competencies they have acquired is evident after all the materials and assignments have been studied and worked on. In the chart 1, we can see the competencies score that have been achieved based on the accumulated score achieved by nurses. An average competency score of 73.08 was obtained. In the chart 2 indicates that most of the participants get a score above average. And this is the conclusion. The trial training with INA-CPD suits the plan. The implementation demonstrates that the majority of nurses are capable of achieving scores that above the average. Additional support is required to conduct the training, which will involve modification to the INA-CPD system. UMY ada, masyarakat berdaya.